So we actually did heart failure before, almost like 40 videos, but those videos were most on like what management of heart failure. Okay, we spoke about drugs. That was under actually pharmacology. Okay, so here now we actually talking about this heart failure, but it's mostly what talking about it related to surgery. Okay, so this is a new course outline, and we are going to study heart failure again, but this is like in a different style, right? We should be talking about heart failure as related to what surgery. Okay, and it's courtesy demands that we look at the course outline so that at least you guys will know what we'll be talking about as we start this series. Basically, we'll be having an outline just like we have it now. Okay, then next video we'll be talking about the introduction to heart failure. Okay, next one we'll be talking about definition of heart failure, right? Next one we'll be talking about the epidemiology of the disease condition. So epidemiology now is simply what um, the number of people that heart failure has affected worldwide. Okay, they'll talk about the classifications of heart failure, various classifications. Okay, we'll be looking at all those heart failure with preserved ejection fraction, heart failure, reduced ejection fraction, and all the stuff. They'll be talking about the possible causes of heart failure, right? Also be talking about the clinical features that could be seen in heart failure, patients with heart failure. Talking about clinical features, that's basically the signs and symptoms combined together. So, precipitants, that's basically some things that, okay, somebody has a heart failure, right? But if these things are in place, they will kind of like trigger it or even worsen it, okay? They'll be looking at the various what investigations, or in the modern world, you could say what evaluations for heart failure. That's basically you are evaluating to know, to diagnose the disease, you are evaluating to know the extent of the disease, you are evaluating to treat the disease, okay? And all the stuff. Then finally, we'll be talking about what possible treatments for heart failure. Okay, so guys, that's it about this course outline for heart failure. I'll see you guys in the lectures to come.